My name is Sandy Sebastian. I am the Director of Women and Children's Services here at the Red Deer Regional Hospital Centre. I wanted to take this opportunity to show you our newly built OBORs and our post-anesthetic care unit, and thank the many people that were involved in the creation of these units. This is the first step in the process. This particular area is the check-in area for both mom and her support person, and they'll be able to sit here together when they're coming in for elective cesarean sections. Both the anesthetist and the obstetrician will come in, as well as the nurses, and interview them right here together as a unit. Then moms will be able to walk into the operating room theaters to have their cesarean section. Those moms that come in from the labor and delivery unit will be on a bed, and they'll just transport right past this area directly into the OR theaters. So we've recently built 2 obstetrical operating rooms that were funded by the Alberta government, and we're also outfitted by our foundation here in Red Deer. So we'll just take you on a quick tour to show you some of the highlights of what's in the obstetrical ORs and in the recovery room area, so that you can get a glimpse of the new care areas we have for our patients and their families. So right over here, we have the newborn resuscitation area. So this particular area actually will have the ability to have twins. So when mom comes in to have a cesarean section, or maybe we're bringing her in here to do a vaginal birth with twins, she'll be able to have both babies in the room with her. So there's lots of space here for the healthcare team to take care of those newborns, as well as the fact that we have dad or their support person in close proximity, and mom, even when she's on the operating room table, will be able to see her babies and be able to interact with her babies. So it's quite a lovely space, and we're quite excited about that. Back at the back part of the room is where our anesthetists will be sitting and caring for moms while they're in the operating room environment. So all the necessary equipment that they have is there for them to take care of her. You'll see lots of equipment here, but then again, we have the operating room table where mom will be when she's having her cesarean section and or any high-risk obstetrical procedure. We would wheel in the obstetrical labor bed and do it right here in the OBOR. If we needed to progress to cesarean section, we could easily transfer to the OR table. So we have the ability to do that in this room with all the space. At the back of the room there, you'll see all the different cupboards that we've recessed into the operating rooms. Due to our lack of space and the fact that we can't have a central core like most operating rooms do, we had to retrofit into our existing family atrium. So we had to make some choices around that. So we put this recessed cabinetry in that will provide us with all the necessary supplies that we need and ease of access for those that are in the theater taking care of mom and baby. Back here we have the nursing station that they'll be able to do their online charting from, as well as the many, many forms we have to do for the government for vital statistics. We have a scientific fridge for the medications that are required for, or may be required for mom while she's in the theater, as well as a blanket warmer for fluids, as well as blankets for both mom and baby. So that's our OR. It is state-of-the-art. You can see that we have actual booms and equipment on booms, so their cords are not on the floor, which is a great advantage for the team, not to be tripping over things. And it really is outfitted with the best of the best equipment, so we're very fortunate about that. We have 2 identical ORs, so they look exactly the same, so we can move between either room, and then healthcare providers know exactly where the equipment is no matter what room they're in. So we've equipped the OBORs with 3 recovery room bays. You'll see that there's the ability for the support person to actually stay beside mom, as well as a bassinet for baby. The philosophy of our whole OBOR environment was to keep the family unit together. So what that means is that even when they check into the OR, they'll have their support person with them. When they're in the theater, they'll have their support person and baby with them. And then as well in recovery room, they'll be able to actually hold their baby skin to skin, breastfeed if they choose to, or the support person can hold the baby, whichever the mom or dad wants to do. And so that's why this particular area was actually designed in that way. You'll see that there's lots of equipment here, but there is the ability for us to care for the family unit as a whole.